This is Delhi. Please stand by for our next program. This is All India Radio. In our national program of talks tonight, we bring you an interview entitled Marching to the Beat of Your Own Heart in commemoration of World Health Day to be celebrated the world over on the 7th of April 2022. In the interview, Dr Prathma S. Mainkar, Senior Principal Scientist, Indian Institute of Chemical Technology, Hyderabad, is in conversation with Muqarrab Hussaini, Program Executive, AIR Hyderabad.
Listeners, in the national program of talks, in the program Marching to the Beat of Your Own Heart, we shall be interacting tonight with Dr Prathma S. Mainkar, who is Senior Principal Scientist and Chair, Department of Organic Synthesis and Process Chemistry, CSIR-Indian Institute of Chemical Technology, Hyderabad. Dr. Prathma Mainkar is a well-known and respected name in the scientific fraternity. She has completed her PhD in carbohydrate chemistry.
Namaste. I am very happy to be with you and share some of my research experiences, especially in the field of drug discovery for diseases like TB and cancer. In addition, we have worked recently on mitigating the disease caused by COVID-19. SARS-CoV-2 virus which causes COVID-19, and that also I'll be sharing today.
To begin with, Dr. Prathma, please elucidate about the initial phase of your research activities and how was the journey to begin with?
Yeah, it was really a very different aspect of research that I had started with, because inadvertently, or maybe because my guide thought that that's an area we should work on, we started working on synthesizing sugars which form part of the Mycobacterium species, which is what causes TB as well as leprosy. So these mycobacteria have a special cell wall, and the sugars which constitute the cell wall are responsible for causing the infection. So my research started with synthesizing these oligosaccharides which are responsible for causing the infection, and they increased a feeling in me that I should work in the area of drug discovery. So that's how my research started, and I was one of those first people who synthesized oligosaccharides in CSIR-IICT, because that was a new field at that point of.
You were associated with some sort of finding a cure for tuberculosis, aren't you?
TB is a disease of maybe 500-600 years old. It has been reported in many of the old scriptures as well. But the thing is, we don't have a proper treatment for TB because the bacterium develops resistance very quickly. So any new molecule that is found, the bacterium finds a way of evading it and becoming resistant. So we have been working on finding new scaffolds which will treat Mycobacterium tuberculosis, that is TB. And we have identified new scaffolds, and we have started the process of drug discovery. The molecules have reached to a stage of getting filed as INDs.
I see. You have worked in the production plants as a project leader to the manufacture of APIs which were made available to the Indian population. Please explain about the term APIs for the benefit of our listeners.
When we take a drug, as we call it, a capsule or a tablet, we never think what goes into that. Yeah. API is the active pharmaceutical ingredient that goes into these capsules or tablets which we take. That is the molecule that is responsible for treating the disease or infection that we have. But in addition to that, a capsule or a tablet will contain other excipients which are not active in any way, but they support the API to make it available to the body when it is required. So we worked on the manufacturing of APIs, especially molecules like trimetazidine or carbidiol, which are used in the cardiovascular diseases. These molecules were manufactured in the plant, and I was the project leader. And I used to many a times stand in the plant, which is a rare thing because not very many women do it, and they don't spend nights in the plant taking batches, manufacturing batches. So I was one of those women who got the opportunity, as well as I had the freedom to work in the late night batches, and I have taken many batches on kg scales.
Yeah, it is really thrilling to know that you have been associated with such a gigantic task of molecular research and carbohydrate drug discovery. Tell us something about your association with the man-made drug called Aeryboline.
Yes, Aeryboline is the largest man-made drug. It is derived from a natural product called helicondrin. But helicondrin is so big that it cannot be made in the lab, and you need tons of the marine sponge to get a few grams of the molecule. So it will not be available for treatment of cancer, especially breast cancers which have become metastatic. So we have synthesized Aeryboline in the lab. The Aeryboline molecule has 19 chiral centers, so there are possibilities of 2 to the power of 19 molecules that can exist, but only one molecule is active out of that. And that molecule we have synthesized. So it can be divided into 3 fragments which are stitched together to make the final molecule. My team has synthesized one molecule out of that, one fragment out of that, and then all the 3 were stitched together. And I'm very proud to say that in addition to ESI, the company that made this molecule, and Dr. Reddy's, which is a generic company, IICT is the only institute which has synthesized Aeryboline in the world.
I see. That is very, very encouraging. And about this carcinogenic effect of Aeryboline, is it not available for mass production?
It cannot be, because the synthetic steps are something like 60 synthetic steps. It is not very easy to synthesize in the lab as well. It needs special training to synthesize it.
Mm-hmm. You have been an active member of chosen and led by IICT Director for developing cost-effective and scalable process for synthesis of IMDG used as in Covaxin, the COVID-19 vaccine. Tell us something about this IMDG.
Sure. See, when somebody develops a vaccine, there are 2-3 different types of vaccine that are available, but the vaccine that is developed by Bharat Biotech uses the human vaccine and human virus and then attenuates it. That is, it makes it non-infective.
Okay.
And then that is given as a vaccine to the persons. But when there is an addition of an IMDG kind of molecule, then the efficacy of the vaccine almost doubles. So when you only the virus is given, the efficacy is around 50%, but by adding adjuvant like IMDG, the efficacy has crossed to 86-87%. So this molecule is very, very important for the activity of the vaccine. The molecule is very complex to synthesize because it has a lot of nitrogen atoms in it, and it is not easily soluble. But the process that was developed by a company in US and which shared with us only 2 milligrams of the compound, they had not developed any analytical methods of analyzing it. They have a very, very complex process of making the molecule, which used corrosive chemicals, which use very costly chemicals. And when Bharat Biotech approached IICT, the task given to us was to make this molecule on kg scales, because the production of vaccine was going to be on billions of doses, and this molecule goes 15 micrograms of this molecule goes into each vaccine dose. Okay. So we were asked to develop a process for making this molecule on kg scales. So the first thing that we did was we looked at the reagents that were used, replace them with reagents and chemicals that are available within our country. So the process becomes totally indigenous, and then we don't have to depend on any other country for making this molecule. Then the purification at each step was using chromatography, but what we have done is we have developed a process by which we have crystallized at each stage, or we have given solvent washes. So the process becomes chromatography purification free, and that reduces the burden of not able to scale up to kg scale. So today we have been able to make this molecule up to gram scales in the lab, and then in the GMP facilities, GMP accredited facilities, kg scales of this has been made. And today we can proudly say that all those who have got Covaxin have 15 mg, 15 micrograms of this molecule made by IICT technology. So I am very proud to be part of this team.
Indeed, you should be. Yeah. So how it is progressing now? And tell us about the difference. We heard a lot, and we have come across so many technical terms regarding the development stages of various vaccines, which are differentiated based on DNA or mRNA. So tell us something about that.
The vaccines that were developed elsewhere, they have used part of the mRNA of the virus, which is encapsulated into an oil-like substance, so lipid nanoparticle, so that it can go into the body, and once the covering is released, then the body starts thinking this as a virus infection and starts making antibodies. Whereas the Bharat Biotech vaccine uses the virus itself, which is inactivated. So that it does not cause infection, but it still body reacts to it and prepares antibodies. So the protection from getting a vaccine is long lasting because your body has seen the virus and developed antibodies for it.
Okay, but at global stage, there is a lot of competition in the, or should I say race, in the marketing of the various vaccines.
Scientists have always been part of the commercial
Or
venture.
should I say money follows science?
Money follows science, that's true. If science is good, then money automatically follows it. But the race has to be there because that only will give us more and more better products so that next pandemic we are ready. We should not be facing problems. mRNA or DNA is a platform. It is not specific to coronavirus. Whereas, so it can be tweaked to meet any challenge, any infection that causes. If you know the mRNA, the RNA sequence, you can always make the mRNA and can create vaccines for that. So that is a new technology which has been developed, and it's a good thing to happen because if you don't have challenges and you don't have competition, you'll stagnate.
India is among the leading nations in the development of vaccines. How do you foresee the vaccine development in general and the pharmaceutical industry in particular?
This pandemic has shaken us all. So I think our pharmaceutical industry will quickly take up working on this because we have been approached by many industries to work on developing these platform technologies of new for future vaccines. So that is something that everybody has become aware of. That will happen very soon because you find a drug for treatment is true, but giving a vaccine protects more people.
Definitely.
So you don't have to get infected and then find your body develops antibodies.
That's
so
true.
Vaccine is a better way of fighting the disease rather than getting the infection and then finding a cure for it. So definitely this is the future. And as we all know that from childhood we are given different vaccines. That has really made our life very comfortable, as well as our life expectancy has increased. Because earlier the life expectancy was something like maybe 100 years back, it was 36, 37 years old.
Yeah.
And now it is 66, 67 kind of.
Yeah.
And we see many people who have got benefited from taking vaccines. So we don't see any smallpox now. We don't see any.
Yeah.
So these are the success stories of our country itself.
Tuberculosis. So how we have captured it successfully, or something needs to be done?
Yes, TB has been a problem for India, but then there are 2-3 areas in which India has done really well. One is the DOT treatments. People have been given the medicine and they have been followed up to take up the medicine. Second thing is with TB is that malnourished people have more incidences of TB. So when the food intake and proper intake is there, then the incidences come down. So that's where I think hunger and poverty and famines have decreased in India. So TB cases have relatively come down. And TB also happens when your immunity is compromised.
Low, yeah.
So when if people are aware of this, then they start building on their immunity and then they take immunity boosters, cases of TB will come down. So India has done really well in all these 3 areas, I feel. But yes, there is always a need of finding a new treatment for TB. So we have recently worked on a molecule called bedaquiline. The process is ready. If industry is ready to take up, we have the process.
I see. The research activities, particularly in the scientific field, IICT stands apart from others. Tell us something about the sphere of activities of IICT.
See, IICT started as RRLH, Regional Research Laboratory, to cater to the needs of the industries in and around Hyderabad. And as the focus of industry shifted, IICT's focus also shifted. So we cater to the needs. And then when IDPL got established in Hyderabad, that's where the focus of the institute changed to working on the drugs. So the first thing IICT did was to do reverse engineering. So make the drugs affordable. That was the first target
for
of
mass
IICT.
consumption.
Yes, mass consumption. But then when we realized that we have to innovate our own drugs, so from 2010 onwards, IICT has started looking for new drug molecules by doing drug discovery. We have a very good facility called National Mole Bank where we store all the molecules that are synthesized or isolated, which can be future molecules for treatment of diseases, human diseases mainly, but also for veterinary use. So drug discovery has become a new focus of IICT. And of late, we have worked on a molecule which is working on idiopathic pulmonary fibrosis. Lungs get affected. This is happening in the case of COVID as well. Post-COVID, the lungs have become very weak and they develop a different kind of tissue called fibrosis.
Okay.
So we have a molecule which is able to treat this.
I see.
So drug discovery has become a new focus of IICT, which is slightly away from doing affordable processes for drug molecules. So we have our own molecules which are going to be the future drugs.
Coming to the center, how do you ascertain the immense significance attached to the research and development activities by the union government?
We, the whole scientific community, is really grateful to the present government for supporting our research activities and encouraging us at every stage. And I'm really appreciative of the government where they are saying that women scientist, I'm a woman scientist. So I feel we have been promoted a lot and we have been given a lot of responsibilities to take up research activities. So I'm really grateful to the government for helping us in taking up research activities. But yes, the focus is also very, very well defined that you should do this. These are the areas where you should be concentrating on. And that has really helped us in taking up new areas of research as well.
Recent times, there is a tectonic shift in the perspective and across the globe about India.
The manufacture of vaccine has really changed the perspective that India had. And during the pandemic, we have supplied so many drug molecules to the world. So people have started looking at us as a dependable partner who can give lot of new molecules as well as drug molecules and vaccines to the world whenever if there is a need.
So in a way, India is leading.
Yes, India
to
is
say
leading.
so. Yeah.
India is leading.
And we have, to our credit, supplied many vaccines to many nations also.
Vaccines as well as drug molecules in the initial phases when the drugs were not available. So we have made sure that the molecules reach the needy.
Per se, it is vaccine or a molecule?
APIs are molecules mostly. Yes, so ready to administer.
Third world nations may not be having those facilities.
Yes.
Apart from these vaccines development, in the drug manufacturing industry, India has always taken a lead. It continues to grow in leaps and bounds.
Yes.
How do you think the budding researchers or young scientists should work in the field of R&D? In the drug and pharmaceutical industry?
There are really many challenges now because what has the pandemic taught us is that you cannot depend on others for making your own drug molecules. So, and then because of the replenishing resources, we have to make sure that we don't exhaust all the resources and then face a problem of not having enough to make the drug molecules. So we have initiated some programs and the government has been asking us to make some new programs where we recycle the reagents. We don't try to get more and more from the nature, but rather than reuse whatever we have been using. And we are trying to capture carbon to make sure that carbon dioxide percentage goes down and we get more molecules out of the carbon dioxide that is used. And all these things are new challenges for researchers which are opening up new areas of research. So it's a very good area to work on.
What would be your message for budding scientists?
Research is something that they should take up with passion. Then
And patience.
Patience, of course. Without patience, research doesn't happen. If you are passionate about research, then it never feels like this is a day I should not work or this is something I should not do. It's always rejuvenating you. You never feel that you are old or tired or you don't want to work. It's never a work because it's passion.
And perseverance.
Perseverance is required for research.
About coming to Hyderabad as such, there are many drug manufacturing units here. Do you think we are in a position to compete and excel with the global firms?
We are already doing that. We are already doing that. 60 to 65% of the generic drugs anywhere in the world are made in India. So majority of it comes from Hyderabad.
Oh, I see.
So we are already competing. We are almost number one in that. The thing is, in addition to doing generic drugs, we should urge the pharmaceutical industries to look after innovation so that new molecules will come. We are already a leader in generic pharma industry, but in addition to doing generic molecules, we should also encourage pharmaceutical industries to take up innovation so that we have our own drug molecules. We don't have to depend on other companies to tell us what kind of molecules are there. And government has started a lot of schemes for doing this. So they should come forward and take up these.
And why foreign drugs are so sought after?
I know most of the molecule that goes into the drugs is made either in India or one of our neighbors. So there is nothing that is manufactured. Most of the drugs are not manufactured in any of the foreign countries. The formulation is done in foreign countries and then the packaged material comes back to us. So instead of depending on them, if we do our own things, it is better because we already do the API. The API is done here. But what I was trying to say was that instead of somebody else finding a cure for us, we should find our own molecules which will cure us. The Bharat Biotech vaccine is a very good example of it.
I see.
It is a strain isolated by National Institute of Virology working under ICMR. It is developed by Bharat Biotech, which is a company based in India, and the adjuvant was provided by IICT, which is an institute in India. So it's totally made in India.
Yeah. So you are hopeful that India will continue to grow and progress in this field?
I'm very confident about that.
So any red tapeism in the patent laws or procedures, formulations, or any such thing?
Of late, all those things have minimized, and everybody is very open to the innovation atmosphere. Also, we have trained manpower who have got trained abroad and come back, and now we have really got all the facilities as well as trained manpower to take up innovation, and we are not facing so many problems as earlier. So I think
it is streamlined.
It's many places it has become a single window operations. So things are falling in line. The atmosphere is conducive for taking up new challenges.
It's very encouraging. Dr. Mainkar, please explain about the cancer and other related areas in which you are working.
We have been trying to develop new molecules or treatments for cancer treatment because cancer is a disease of multiple angles. Once it comes to an organ, it goes to another organ, that is called metastasis, and treating the primary organ is many a times easier, but going to the secondary organ is very difficult. And then there are some parts of our body where the disease, the molecule or the drug does not reach. So one example is pancreatic cancer, where because it's embedded within an organ, so a drug reaching to the site is very difficult. So we have identified a natural product based molecule which is working on pancreatic cancer, and it is working really well, and we are trying to develop it further to become a drug molecule. Hopefully within the next 5-6 years we should have a new drug molecule treating that.
You are also associated with the development of one antifungal compound for the fruits like mango and strawberry.
This was during my tenure in the industry.
Okay.
We were working on an antifungal molecule for treatment of skin diseases, especially for people who work in the fields and they are always, their feet are specially immersed in water when they are doing plantation and taking care of the plants. So when the fungal disease appears on their nails and feet, we wanted to develop a molecule for treating this disease. But then when we realized that there is we have synthesized analogs of that molecule, and one of the analog we found that it is working very well for treatment of fruits, the fungus which grows on fruits, especially when the fruits are taken down from the tree and which are getting transported to different parts of the world for going to be consumed. So what happens is post-harvest treatment is something that needs more attention because the fungus or bacterial infections happen during that, and then the fruits get spoiled. But if you use chemicals to treat them, then the amount of chemicals that go with the consumption of the fruit are increasing in the bodies. So this is a molecule which is very close to the nature. It is a natural product. So we have developed that molecule to treat the fruits so that the infection does not occur to the fruits while they are getting transported, after they are taken down from the trees or plants and then being transported.
It is applicable to all the fruits, or it is
No,
specific to?
They are specific, especially fruits like strawberries or mango, which are very delicate.
Okay.
And strawberries you eat with the skin, and mangoes also the skin is very.
You got OPPI Women Scientist Award in 2016, and also your team got award for the development of Favipiravir, the first line of drug in the treatment of COVID. How fulfilling it is, and what was your reaction initially?
Getting an award is always gives you more boost to work in these areas, and I'm very proud to say that CSIR, our parent body, has recognized our efforts in mitigating COVID infections. So we have consecutively 2 years got awards, CSR Technology Award it is called, which is given on September 26th. And then we have got 2020 the award for process of Favipiravir, and 2021 for the IMDG molecule which goes into Covaxin. The OPPI award I got was for my contributions in drug discovery, especially TB and cancer. It's given to a woman scientist in addition to other scientists as well, young scientists and scientists performing in research. What we need to have is we should have an award for people who are working in translational research areas, like developing a process and transferring it to industry. That's something that is not been recognized very well in our country. So that is an area where we need to work on.
R.C. Bhatnagar Award, I believe.
SS Bhatnagar Award, but that is for scientists working below 45 years of age.
Achha, for young scientists.
Young scientists. So that is something that is recognized, but
that's a very good point you have highlighted, and hope the concerned will take note of that. As a researcher and senior scientist, do you feel concerned about the recent hue and cry made due to the shortages of Favipiravir and related drugs?
We were ready with the processes. We had shared the processes with many industries, but they had certain inhibitions because they thought that there may not be a need of consumption of these molecules. But we were ahead of times. IICT team had developed processes for Favipiravir, Remdesivir, Umifenavir, then 2DG. Everything was ready with us, and we had shared with lot of companies. But the commercial angle is something that
that
I
we
cannot
discussed
comment.
earlier. Yeah.
I can't comment much on that.
Yes. And the dynamic and far-sighted leadership of our Honorable Prime Minister Shri Narendra Modi, India has become a happening nation in the League of Nations.
Very true.
Yeah.
We are very grateful to that.
Particularly in the
Science
and technology fields.
Definitely.
Dr. Prathma Mainkar, pleasure talking to you.
Thank you. It's my pleasure.
In our national program of talks tonight, you just heard an interview entitled Marching to the Beat of Your Own Heart, in which Dr. Prathma S. Mainkar, Senior Principal Scientist, Indian Institute of Chemical Technology, Hyderabad, was in conversation with Muqarrab Hussaini, Program Executive, AIR Hyderabad. This program was in commemoration of World Health Day, to be celebrated the world over on the 7th of April 2022. Conceptualized by Naveen K. Gupta of AIR Delhi, this program was produced and presented by Muqarrab Hussaini, Program Executive, AIR Hyderabad, and came to you from the Delhi station of All India Radio.